Hello, everyone. Welcome to Grand Rounds. Thank you for coming today. I am Iris Borowski, and it is my pleasure to introduce our speaker today, Dr. Amy Gower, who is a research associate in our division, the Division of General Pediatrics and Adolescent Health. So to give you a brief background, Amy received her undergraduate degree in psychology and women's studies at Wellesley College in Wellesley, Massachusetts. She then made her way to Minnesota, where she earned her master's and doctorate in child development at the Institute of Child Development here at the University of Minnesota. I met Amy in 2011 when she joined our division as a postdoctoral fellow in child and adolescent primary care research. After completing her fellowship, we were thrilled and very fortunate that she chose to stay on in our division as a research associate. So Amy's research focuses on the health and well-being of vulnerable populations of youth, including LGBTQ youth and youth of color, and the role of stigma or bias in health. Critical to her research is a focus on modifiable protective factors for health risk behaviors and communication of the findings to healthcare and other professionals who work with young people. To date, her work has yielded nearly 50 peer-reviewed publications. She is also currently co-investigator of a CDC-funded study that aims to improve the quality of rural adolescent health services. So Dr. Gower will share some of her expertise and research in her presentation today, entitled Bias-Based Bullying Experiences Among Adolescents, What We Know and Why It Matters. So please join me in welcoming her.
Thanks, Iris. Good morning. I'm here to tell you, as Iris mentioned, a little bit about some work we've been doing over the last 4 years to really explore and understand more about bias-based bullying. And I'm particularly interested and excited to share these results with you all as clinicians, because I think healthcare providers have a really important role to play in supporting young people who've experienced bias-based bullying. No financial relationships to disclose, and I won't be talking about any kind of drug use today. I'm going to start today with kind of the basics. What are we talking about when we talk about bias-based bullying and why it matters for health and well-being? And then I want to tell you about findings from 2 studies that we've been working on. The first is a little bit hot off the presses, a new study where we've been talking to young people about what they mean when they talk about bias-based bullying, how that looks for them, and how schools and parents are or are not involved. And then for the last part of the talk, I want to tell you about some findings we've uncovered with Project Respect, which is a project that was designed to understand how the social, community, and school environments can be protective, particularly for LGBTQ youth. That study was more broadly focused on health. I'll tell you about the findings particular to bias-based bullying today. So first, what are we talking about when we talk about bias-based bullying? I'm sure everyone in this room can rattle off the 3 key characteristics of general bullying: that the behavior has an intent to harm, that there's a power imbalance between the person doing the bullying and the target of that bullying, and that the behavior is either repeated or has the potential to be repeated. So when I talk about bias-based bullying, then that includes those behaviors that are motivated by some personal characteristic of the young person or the target. So that could be race, ethnicity, national origin, religion, gender and gender expression, sexual orientation, weight, ability, socioeconomic status. Could be a wide range of factors. Excuse me. Today I'm going to use the term bias-based bullying, though, a little bit more broadly. I'm going to use it as a kind of an umbrella term to encompass a wide variety of behaviors that are rooted in stigma or bias. So that may include bullying behaviors, but it'll also include things like name calling, harassment, and microaggressions, which are indirect or subtle and sometimes unintentional acts that are directed towards marginalized groups. So when we talk about bias-based bullying, these behaviors can be direct, so the kind of face-to-face encounters you might think about, punching someone, calling them a name directly, kind of in that back and forth way. They can also be indirect, so things like behaviors that happen online or spreading rumors about someone that aren't done to someone's face. We'll include physical acts here, the kind of traditional punching someone, as well as verbal insults or comments, behaviors that happen online, and relational behaviors. And what I mean by that is using the relationship as the vehicle of harm. So things like spreading rumors or threats to someone's social standing, excluding someone, things like that. When you hear in a little bit the qualitative work talking about what the young people say when they talk about bias-based bullying, this broader definition will make even more sense. I'd like to give you a little bit of an idea of the prevalence of bias-based bullying in Minnesota among adolescents, and to do that I have to use our very favorite survey, the Minnesota Student Survey. This is our state surveillance survey that is administered every 3 years to public and charter school students in Minnesota. Districts decide whether they want to participate and at what grades. It's offered at 5th, 8th, 9th, and 11th grades. In 2019, about 81% of school districts participated in at least one grade, and you can see that gives us pretty good coverage of 5th, 8th, and 9th graders that are enrolled across the state, a little bit of a drop-off for 11th graders, which we often see. So the data that I'm going to talk about today come from, for the most part, the 8th, 9th, and 11th grade surveys. The only exception to that is sexual orientation, and sexual orientation-based bullying was only asked of 9th and 11th graders. So those results, excuse me, will be specific to those groups. So the Minnesota Student Survey asks about 7 different types of bias-based bullying. And the question starts, during the last 30 days, how often have other students harassed or bullied you for any of the following reasons? And you can see the items assessed: race, ethnicity, or national origin, religion, gender, gender expression. And for that question, they gave the examples of your style, dress, or the way you walk or talk. And the percentages in the far right here are for the number or the percentage of students who reported any of these behaviors in the past 30 days. So you can see that weight-based bullying was the most common, with just under a quarter of youth reporting that they'd been bullied based on their weight in the last 30 days. And religion, sexual orientation, and gender-based bullying were the least common at around 7%. But these averages really mask some large disparities in experiences of bias-based bullying. So let's break this down first by sexual orientation. In 2019, the Minnesota Student Survey asked 9th and 11th graders to indicate whether they were gay or lesbian, bisexual, pansexual, queer, or questioning their sexual orientation. And I've grouped all of those young people together just to kind of illustrate what we're talking about here today, and I'll break it down in a minute. As we know, LGBTQ youth are not a monolith, and there's some important variation there. So not surprisingly, LGBTQ youth, who are represented here with the gold bars, were about 10 times more likely to experience sexual orientation-based bullying than their straight peers. They were also more likely to report all of the other forms of bias-based bullying. All of these differences are significant. And this is a pattern that we've seen since we started looking for it in about 2013, that youth in marginalized groups tend to experience bullying on a wide range of characteristics, whether they have those characteristics or not. So for the first time in 2019, the Minnesota Student Survey gave a couple of additional options for sexual orientation that are terms that young people seem to be using a bit more. So they allowed young people to identify as pansexual, meaning attracted to all genders, not just binary male and female genders. And they also allowed a queer response option, which can be used as an umbrella term or sometimes used to indicate a more fluid sexual orientation. They also added the ability for young people to say they don't know what this question means, so those young people are taken out of these analyses. But you can see that sexual orientation-based bullying varied a little bit based on the identity. So gay, lesbian, pansexual, and queer youth reported the highest rates of sexual orientation-based bullying. And among LGBTQ youth, those questioning their sexual orientation had the lowest rates. So looking now by gender identity, in 2019, 1.4% of youth identified as transgender, genderqueer, or gender fluid, and another 1.8% indicated that they were questioning their gender identity. So I've combined those here for that about 3.2% or so, and we use the umbrella term transgender and gender diverse, or TGD, to indicate these young people. And we're comparing them here to cisgender youth. So those are youth whose sex assigned at birth matches their current gender identity. As you can see, the trans and gender diverse youth, represented by the gold bar here, reported far more gender and gender expression-based bullying, as you might expect. And again, that pattern of all of these differences are significant, seeing more bullying based on a wide range of bias among this group. When we look at bullying based on race, ethnicity, or national origin, and break it down by race and ethnicity, we again see these disparities. Youth of color were much more likely than white youth to report bullying based on these characteristics. About 20% of youth of color across identity groups reported race-based bullying. We also saw significant differences by race and ethnicity on the other forms of bullying as well. Gets a little difficult to communicate in slides because there are some differences. They're not quite as uniform as these results would indicate, but in general, American Indian youth and multiracial youth reported the most bias-based bullying, and there were sort of variations depending on the type of bias looked at for the other forms of bullying. So and finally, I just want to talk about weight a little bit. On the Minnesota Student Survey, young people self-report their height and weight, and then the Minnesota Student Survey team calculates BMI and creates this standard obese and overweight cut points to maintain anonymity in smaller schools in the data. The underweight and healthy weight groups are grouped together by the MSS team. So that's what we have here. There's about 3/4 who are in that underweight and healthy weight group. 14% of the sample were categorized as overweight and 11% as obese. So when we look at these weight classifications, we can see the differences in weight-based bullying that we would come to expect based on the data. Over 40% of youth who are classified as obese report weight-based bullying. About 27% for youth who are overweight, and then 19% in that healthy and underweight group. There were also significant differences for all the other types of bullying. I've illustrated sexual orientation and ability-based bullying here, just to give you kind of an idea of what the pattern looks like. You can see the differences are a little bit more modest in these groups than some of the others, but the pattern repeats over and over that obese youth report the most bias-based bullying, overweight youth a kind of intermediate amount, and then that under and healthy weight the lowest amount. So why do we care about separating out bullying that's based in bias from general bullying? Why does that matter? For one, bias-based bullying is as harmful or more harmful to health than general bullying. Research has been pretty clear on that lately. And another reason is that during adolescence, which is already a stressful time, youth from socially marginalized groups experience additional stress related to this bias-based bullying that their peers without these socially marginalized characteristics don't experience. And that has real health implications. Kind of is thought to underlie or drive some of the health disparities we see in these populations. We call that kind of stress minority stress when we're talking about LGBTQ youth in particular. And minority stress causes emotional distress and can lead to social withdrawal. In adolescence, that's particularly important because the experiences that we know help young people thrive, positive youth development opportunities, close, engaged, and connected relationships with schools, involve social interaction. And that's harder for young people to do when they're coping with some of this stress. And finally, coping with bias-based bullying in the short term, some of these means of doing that are not necessarily adaptive. So drinking, vaping, smoking, and drug use, which can all lead to short-term harm and increase the risk of longer-term addiction. So a number of studies have documented the associations between bias-based bullying and health outcomes, and you'll see there's pretty wide overlap in this list with what we might expect and what we've seen for general bullying as well, which suggests to us that some of the same things are going on, but possibly more magnified for bias-based bullying. Excuse me. We see those clear associations with emotional distress, with substance use, disordered eating, and sexual risk behaviors. We also see reduced school attendance and academic performance associated with bias-based bullying. And this really seems to be about the fact that when you're experiencing bias-based bullying, school doesn't feel as safe. And it's really hard to learn when you don't feel safe. In addition to emotional and social kinds of distress, we're starting to learn more about how bias and experiences of discrimination and bullying might be related to physical health. There are a lot of hypothesized pathways here through things like immune and cardiovascular function, inflammation, endocrine and metabolic function as well. But a lot of this work has been done with adolescents, or with adults where it has been done, and reports of bullying have been retrospective. So that's really an area for future research with adolescents to understand these mechanisms. Let me just give you one quick example back to our favorite Minnesota students survey here, looking at depression. And we're kind of categorizing or considering depressive symptoms as a positive screen on the PHQ-2 here. The top two bars are broken down by cisgender and trans and gender diverse youth, and we're also looking at the way gender-based bullying is related. So you can see this top bar in navy or black, the darkish color, is cisgender youth who report gender-based bullying in the last 30 days, with that second kind of bright red bar being cisgender youth who haven't experienced gender-based bullying. The bottom two bars in maroon and gold are for transgender youth and gender diverse youth who have or have not, again, experienced bias-based bullying, or gender-based bullying, excuse me. And you can see that these differences are pretty apparent for both cisgender and trans and gender diverse youth, that bias-based bullying is associated with more depressive symptoms by a pretty fair amount in this group. So in sum, we see that bias-based bullying is relatively common among adolescents in Minnesota who have socially marginalized characteristics and identities. And the bias they experience can be about a range of things, not just their own personal characteristics. We care about this bias because it's an additional stress in adolescence that can really underlie health disparities and cause challenges for youth of color, LGBTQ youth, and youth who are overweight. One way to work toward health equity in this group, then, is to reduce and eliminate bias-based bullying. But before we can do that, we really need a better idea of the experiences young people are talking about when they talk about bias-based bullying. And those findings that I've just summarized really led us to want to know what kinds of experiences are youth talking about and thinking about when they answer this question. What, in their own words, are they experiencing? We were also interested in kind of what schools may be doing, what they may not be doing, and what young people wished they were doing in response to bias-based bullying. So to do this, we recently began a new study with a grant from the Department of Pediatrics to conduct qualitative interviews with young people and their parents matched up in dyads, and then also with school personnel. And we took this qualitative approach because we wanted to understand kind of the full blanket of harassment, teasing, name-calling, slurs, kind of the full scope of this behavior that young people are talking about. And we also undertook this work with an eye towards prevention and intervention. We really were hoping to get some insights that could make prevention and intervention more effective. We're about halfway through this grant right now. We've conducted all of the youth focus groups. We've conducted all of the parent and youth dyads. We have just a couple schools left. One was just done yesterday, so we're hoping to wrap those up here quickly. And with that being said, what I'm telling you about today is some of the very first kind of hot off the press and also preliminary analyses we have from one part of that study. So just keep that in mind. So for the youth groups, we recruited from existing youth boards and youth groups within schools and communities. And we specifically sought out groups that were working on race-related and LGBTQ-related issues. The groups that we selected were full of young people who were leaders in their community, often engaged in advocacy work in their schools and communities around this issue. And as a result, they had a lot to say about both their own experiences with bias-based bullying, broadly construed, and also their peers and friends' experiences. We also recruited a focus group from patients attending a weight management clinic to be a little bit more intentional about understanding weight-based bullying. So participating youth were between the ages of 12 to 18, and they were diverse in terms of race, almost half identified as Black, and diverse in terms of sexual orientation. About half fall under the LGBTQ umbrella, and the other half identified as straight. All but one spoke English at home, and only one participant in this portion of the data identified as trans or gender diverse. We were very intentional about recruiting in the parent and youth dyad interviews to make sure that we were including that perspective. So there'll be a little bit more to come about that. Excuse me. So most of the youth groups already had a rapport established because these groups had been meeting consistently over the course of the school year. For the weight-based group, we really spent a little bit of time developing rapport. The interviews lasted about 60 to 90 minutes. They followed a semi-structured interview guide with probing as needed. And we were really interested in understanding what youth were talking about, what their experiences were. So we first asked, what are some things at your school that kids get teased, harassed, picked on, or bullied about? We probed for specific examples and details, and we also asked what schools and parents did about those experiences. Knowing that schools and parents may have some room to grow, we also asked young people what they wished happened. So we said, if you had the opportunity to give advice to your principal, teachers, or other adults at school about the things they should be doing about bias-based bullying, what would it be? Interviews were coded by two fabulous research assistants, and they were coded to consensus, and then themes were identified. The data were quite rich, actually, and quite a few themes emerged from these focus groups. First of all, we heard that bias-based bullying was frequent, and it comes in many forms. One of the ways that young people talked about bias-based bullying being used was as a way to kind of enforce stereotypes. And we heard a bit about how bias-based bullying can lead to retaliatory aggression, often physical. We talked some as well with youth about schools. We're looking forward to crossing that in the future with what the schools were telling us. But youth really perceived, for the most part, schools as not doing too much about bias-based bullying in these interviews. When the schools did respond, young people perceived the responses as being not severe enough, ineffective, and particularly lacking follow-through to make sure that the bias-based bullying doesn't happen again. And we heard over and over that schools didn't act soon enough. So when these behaviors were more verbal slights or insults, schools were not as interested in responding, but there was kind of a bright line when a physical fight broke out or sexual harassment or something like that that would cause the school to intervene. So I'm going to focus on the first three themes today, just to give you a sense of what young people are talking about and experiencing. So first of all, youth talked about just how frequent bias-based bullying is, and they gave a wide variety of examples of the forms of bullying they'd experienced or seen. Many examples were verbal, including name-calling and slurs. So for an example, a 16-year-old told us, because a lot of people call others the N-word. A lot of people say that, and that makes me offended. A 17-year-old told us that he hears the F slur probably twice a day from different groups of white guys. We also heard quite a few examples that were online kinds of bullying or relational, where someone was excluded or rumors were spread. For an example, a 14-year-old told us that someone was spreading rumors that I was pregnant because that's where I gain all of my weight, and talking about weight-based bullying. We heard very few examples of physical bullying in these groups, and in fact, young people commented that that kind of traditional or stereotypical physical bullying scenario doesn't happen very much and is really kind of decreasing. The other thing I just want to mention is that when youth were asked about weight-based bullying, they were very reluctant to talk about it, particularly in the groups that were not recruited specifically to talk about weight-based bullying. Young people would mention that weight-based bullying happens and tends to happen frequently, but they were not going to be talking about the details. That was clearly an area that was kind of off limits that they were not too willing to talk about, at least among their peers. We're hoping to hear a little bit more about that in the dyadic interviews, where we're just talking one interviewer and one adolescent together. One thing that youth really talked about and that came through in the quotes was this idea that bias-based bullying was kind of used to enforce stereotypes by peers. And these acts seemed really intended to call out behavior that was not in keeping with stereotypes, or to make fun of behavior that was too close to stereotypes, particularly about race and gender. And this enforcement often came from other youth within the stigmatized group. So, for example, a 15-year-old told us in talking about bullying, all the time, because personally, if I'm trying to answer a question and I might use a big word or something, he'll be like, oh, dang, she's talking like white over there. So we heard some examples like that. Here's one more example that we heard. A 17-year-old told us that I've gotten picked on a lot for my truck, especially me listening to Hispanic music. Oftentimes, I'm the type of person to listen to music at very high volumes. I get called out for that, for being too Mexican, and I put that in quotation marks, he said. So we really heard about youth being bullied for behavior that was, air quotes here, too black, too Mexican, but also not black enough, not Mexican enough. These ways that stereotypes are really used to kind of enforce behavior. And as you can see, there was a very narrow range of accepted behavior as far as peers were concerned. Student targets of bias-based bullying sometimes told us about times they retaliated after being repeatedly bullied, or called names or different kinds of slurs. And we saw this particularly for race, sexual orientation, and gender-based bullying. So targets of this kind of bullying seem to really escalate to physical violence, typically when the school had repeatedly failed to intervene, or when the school attempts at intervention were not perceived as effective, and that the bullying kept going. So, for example, a 16-year-old told us, sometimes you've got to fight for what you want, because the school ain't going to do much about it. A 12-year-old also told us, one of my friends, they told him, go back to Mexico, and that's why Donald Trump's building a wall, so y'all Mexicans won't come. And then my friend got mad, so we punched him in the face, and they started to fight. And these things, it seems like from the quote, one incident, but they kind of build and repeat on one another. And one of the things that makes this so complicated, right, is that the previous incidents of bullying that have happened, or name calling or teasing, weren't necessarily coming from the same person. So, for example, the student could have been teased or bullied multiple times by other students, but once that tipping point is reached and the target retaliates, they're retaliating against the one person who's in front of them. But that may or may not have been the person doing those previous acts. And when this happens, from the school perspective, it can look unprovoked if they don't know about the other incidents, and that can really set in motion a cascade of disciplinary actions, including suspension and expulsion, which are obviously a huge problem for the target of that bullying. We did hear one case where a teacher stepped in and said, wait, actually, this is part of a bigger pattern. This has been going on. But at the point the teacher thought to intervene, the physical retaliation had already happened and the disciplinary consequences had already been delivered as well. So that can be a real challenge. So to summarize these qualitative interviews, you've made it really clear that they are surrounded by bias-based bullying, teasing, harassment, and these things happen not only to them, but in the hallways, to their friends, to their peers. It's kind of vicarious victimization as well. This really contributes to a climate of bias that can make it hard for some kids to focus on learning and academics. One of our biggest takeaways from these analyses so far is that the wide range of experiences young people are talking about really vary. They range from name calling to a few experiences of physical bullying. But very few of them involved the kind of one student doing bullying and one target receiving that bullying over and over again in kind of an obvious way, which seems good at first, except that all of our state laws and school board policies are designed for this kind of one-on-one relationship-based bullying. And so what we find is that young people come to school administrators or teachers with these experiences, and they don't know what to do. They don't have great policies and things they can fall back on and say, okay, I heard about this, I know exactly what to do, and my policies and procedures are clear and effective. So that's a huge opportunity, and we're really looking forward to having that conversation with schools and educational audiences as well. Finally, it became really clear that schools need to take these experiences seriously very early at the name calling and the insult stage, at a time where they might be more likely to say, like, that's not bullying, just ignore it, or do some quick intervention. That intervening early and following up on that is an important way to prevent the kind of physical escalation that we're seeing. So I can't do a talk with all bad news. I don't have it in me. So I want to turn to some work we've done on the social environment and how the social environment might be protective for young people who've experienced bias-based bullying. So this work comes from Project Respect, which stands for Research and Education on Supportive and Protective Environments for Queer Teens. That project was done in Minnesota, Massachusetts, and British Columbia, Canada from 2014 to 2019. And it was really focused on understanding how the social environment may be protective for LGBTQ youth. So we know that LGBTQ youth in particular, as well as all youth, are embedded in broader social environments. They go to school, they live, they work, they play in a wide variety of environments that are nested. And those environments vary in how supportive they are for LGBTQ folks. And that means that they also vary in the levels of stigma that are involved. So for Project Respect, one of the main goals was to find a way to quantify the LGBTQ supportiveness of communities and schools, and then see how that supportiveness was related to a wide range of health issues. I'm going to talk specifically about our findings related to bias-based bullying this morning. So first of all, let me just say that figuring out how to come up with a number that quantifies the LGBTQ supportiveness of a community is no small task. And then to collect that data for all of British Columbia, 435 cities in Minnesota, and over 300 cities in Massachusetts, also not a small task. So this is a long project with a lot of wonderful folks doing a lot of hard work, and I just want to acknowledge that off the bat. What we ended up with after all of that work, though, was, I think, a pretty good sampling of ways and domains of LGBTQ supportiveness. I'm just going to highlight the pieces of this that are relevant to the bias-based bullying analyses today, and I'm happy to talk at the end about what we did more broadly if people have questions. So in the school domain, we had information about whether students attended schools that had a gay-straight alliance or a gender and sexuality alliance. I'll call that a GSA, just for our purposes here. And we know GSAs are widely protective for LGBTQ youth on a number of areas, including emotional health, bullying, and substance use. We also talked about community resources and cataloged community resources, LGBTQ supportive youth serving organizations, and then social, economic, and political environments. And I'll tell you a little bit about those in just a minute. But our first task was to define communities for the purposes of our research, which was also not a small task. But we partnered with the folks at Youth Spatial, which they had some great expertise and really great insight to help us do this kind of spatial and geographic information systems work in a really interesting way. So our plan was to link the community data that we were going to collect with Minnesota student survey data. And those data are collected anonymously, so we did not know where young people lived. However, we did know where they went to school. And so that is what served as kind of the basis for mapping and thinking about geography. And then with Youth Spatial, they created 15-minute drive times around each school that would let us kind of define community and come up with a number to quantify the supportiveness. So let's just take a look at this on a map because it is a lot more intuitive that way. These black dots here represent the 81 schools that were in our sample. These are schools that participated in the Minnesota Student Survey at 9th or 11th grade or both in 2013. Schools that participated in a CDC and Minnesota Department of Health survey called the School Health Profiles, which is how we found out if they had a GSA, and that had at least 10 LGBTQ students on the Minnesota Student Survey responses. We needed that for statistical reasons to make sure our analyses were valid. So for these 81 schools, Youth Spatial drew the 15-minute drive time or community buffers. And you can see these are kind of kite-shaped for the most part. This is how far you can go from the school in any direction in 15 minutes following all of the applicable traffic and speed limit kinds of laws and things like that. And they look a little kite-shaped because highways with higher speed limits tend to go north, south, east, west, and so it's easier to get a little further in those directions. You can see up towards the northern part of the state, there are places where either the country border or a very large lake might have impeded how far you can go as well. So that's why there's a little bit of variation in shape. These are sort of really true to how far you can go from 15 minutes from the school. And once we had these buffers, we were able to search all the cities within them. And we had a protocol where our coders searched about 19 search terms for each city to try to find all of the LGBTQ youth serving organizations within those buffers. And those are places that have at least one service specifically for LGBTQ youth only. So that might be a drop-in hour, it might be a youth group, something like that. We also cataloged all of the LGBTQ-friendly community resources we could find in that area. And those ranged very widely, from advocacy organizations to bookstores to coffee shops, mental health providers, primary care providers, places of worship, things like that. Those are places that either said they were LGBTQ-friendly or open or welcoming, or we heard through word of mouth by being on reference lists or something like that, that they were friendly. And these were all mapped by Youth Spatial, and eventually they were able to give us kind of summaries for each community buffer that quantified the supportiveness. So let's look at LGBTQ youth serving organizations for a moment. There are fewer of them, which makes it easier to look at on a map. As you can imagine, there were hundreds of resources in the Twin Cities area. These orange pins are youth organizations that we saw. And you can see, depending on where you are, there may have been more than one youth organization, particularly in the Twin Cities. And as you get further out into greater Minnesota, some buffers had maybe one LGBTQ youth serving organization or none at all. And these were rated on several characteristics. So we had some measures of convenience, whether they were open on the weekend or on a public transit line, excuse me. We also used Google Maps and did the street view to see whether their signs had any indication about being LGBTQ friendly or specific to LGBTQ people. A rainbow flag, a trans pride flag, for example, kind of any of these things. And we also characterize them based on the services they provided, whether they had confidential services, a licensed mental health care provider on staff, things like that. The final kind of indicator or domain that we looked at were economic and political indicators. And there are three that were relevant to the analyses we talked about today. The first is the proportion of same-sex households within that buffer, which we have from some American Community Survey data. And then using election data, we were able to quantify two other things. One is the percent of people in that buffer voting for a major party candidate that supports LGBTQ rights. In the United States in 2012, that was a vote for Obama-Biden for president. And if you lived in Minnesota in 2012, you might remember there was also a constitutional amendment on the ballot at that time to limit marriage to one man and one woman. So a no vote on that was in support of LGBTQ rights. Confusing on purpose. And so the percent of people voting no on that constitutional amendment was also another political indicator that we used. So we created statistically a factor score combining these political and economic indicators, the LGBTQ youth organizations, the community resources, together to get a factor score that looked at supportiveness. And then, using our Minnesota Student Survey and measures of bullying, we conducted several logistic regressions looking at general bullying, so relational, physical and cyberbullying, as well as a few indicators of bias-based bullying. And we entered that community support factor I just talked about. We also entered the presence of a GSA and several control variables like race and ethnicity, receipt of free and reduced price lunch, and the school location. And we looked for differences by assigned sex as well. And what we found is that the presence of a GSA was protective specifically against sexual orientation-based bullying and specifically for youth assigned female at birth. When we looked at LGBTQ community support, it was associated with both sexual orientation-based bullying and weight-based bullying, and again, specifically for youth assigned female at birth. So we see that that kind of LGBTQ community support in both communities and schools was protective, but it seemed to be particularly focused on bias-based bullying. We did not see significant associations for gender or for general bullying. I'll just say that we also have some findings from this study showing that political climates and community resources protect against suicidal intent and attempts and self-harm among girls in British Columbia. And in both British Columbia and Minnesota, we saw that LGBTQ supportive environments protect against substance use, especially frequent substance use. So this study from Project Respect really demonstrates the way that supportive communities and environments can protect against bias-based bullying, particularly for LGBTQ youth and particularly for those assigned female at birth. But these findings didn't extend to general bullying. And that suggests for us that there's really room for additional resources and prevention activities that are necessary, and for boys as well, to identify those protective factors and environments for boys. So we have several next steps for us that we are planning on taking. First, we want to take the next steps to kind of generalize these supportive communities and school findings to other groups, looking at, for example, diversity education efforts in schools and how that's related to race-based bullying. That's one of the things that we'll be undertaking in the second year of the Pediatrics grant. We are also interested in using the findings from our qualitative interviews to really start more conversations with school and education folks about bias-based bullying, broadly defined, and what kind of the needs and opportunities are for better intervention, prevention, and policies. And finally, we want to understand how schools' kind of general bullying policies and supportive climates for these vulnerable groups might work together or might not work together to protect young people who are particularly likely to experience bias-based bullying. And that brings me to your next steps. If you take one thing away from this talk today, I hope that it is that youth with socially marginalized characteristics are particularly likely to experience bias-based bullying, but it may happen so often that they may not think to bring it up, or they may not talk about it without being asked. So please ask. This can happen in more formal screening kinds of ways. For example, the new expanded ACEs questionnaire includes questions about bullying, but it can also happen in less formal discussions. And either way the screening happens, what we have learned is that your words need to be open-ended and general. Just asking about bullying is not going to get researchers or clinicians very far when we're talking about bias-based bullying for young people. It's a much broader conception of behaviors than bullying kind of encompasses. So asking about how school is going, how things are going with peers, and whether there's an adult that you can talk to at school can be really important. We know that open communication with teachers and with schools can really help intervene before that physical retaliation and provide context and opportunities for early intervention. Youth are hearing from schools and sometimes parents that they should just ignore these kinds of name-calling or insult experiences, especially if schools are only hearing about one or two experiences. It may seem like, oh, it's not a big deal, just ignore it. But young people are telling us that they hear this all the time, all day. And so ignoring it is not going to be effective. So one thing that can really be done is to validate that this is not okay, and be an adult who listens and hears that and takes it seriously. For youth who do report bias-based bullying, we know that there can be a lot of emotional distress. And so screening for that and having ready-to-go resource list of culturally competent mental health care providers for referral can be really important. The other thing we heard is that parents seem to be struggling to know how to support their young people. And clinicians can provide just a little bit of brief education to dispel these myths about just ignore it and it'll go away. And the other thing clinicians can do really time effectively is to connect parents with resources. So I want to just tell you very briefly about this one resource that is through the Minnesota Department of Education. They have a great website, and this top link here, how to work with the school to address bullying, is basically a guide for parents about how to document these things, who to talk to first, who to talk to next, what their options are, and ways to support their young people. It's a really great go-to that all parents can use, and clinicians can kind of have that handy to link up parents and families with supportive school resources. I'd like to really thank my fabulous colleagues who've done a lot of hard work on this, and we've done a lot of great thinking together. This work takes big teams, and we're really appreciative of everyone, and it wouldn't be possible without all these folks and without funding, of course. I'm happy to take any questions that you have.
Thanks. Excuse me. That was a wonderful talk. The focus here is on the victims of the bullying. I'm curious if there are efforts to understand the characteristics of the people doing the bullying, and what are the factors that motivate those behaviors. What can be done on that side to understand what leads a child or an adolescent to adopt these behaviors?
Yeah, that's a great question, and definitely an area for future research. A lot of work on general bullying has clearly established that kids doing bullying can often be targets of bullying themselves. So kind of extending that work and looking related to bias-based bullying will be important. One of the things that we've started to hear in the school team interviews is that they perceive young people using some of these terms and using some of these insults, maybe doing it without having a full appreciation of the kind of historical context of some of these terms and the broader context and why what they're saying and doing is hurtful. And so that is also another area where some schools are starting to use that as opportunities for education and to open up conversations, which I think will be really helpful. But there's a lot more to learn there. It's a good point.
So
Amy, again, thank you. So bullying's been in schools as long as I can remember being in school. So has there been any research to look at why the schools fail? They've had, at least 60, 100 years to work on this, but the schools don't seem to be able to impact this problem.
Yeah, it's a great question. I think one of the things when we think about bullying, right, is bullying has been in schools and has been in communities for a long time, and it serves a purpose, right? When you're an adolescent and you're starting to understand your peer group and trying to kind of navigate the boundaries of peer groups and things like that, it's one effective way to say who's in and who's out. And so I think one of the areas where bullying prevention has really focused is on saying this behavior is not okay. But from my perspective, it also doesn't provide another way to exhibit those kind of leadership qualities or manipulate your peer group in ways that are pro-social, that may be positive. And so I think that that's an area where schools are starting to take steps with social emotional learning and things like that to promote leadership and promote senses of community and inclusion. But we're not there yet, and it's a big opportunity. When we take those lessons and try to apply them to bias-based bullying, I'll be honest, I have more questions than I have answers about how to do this effectively at the school level, and I think that that's not uncommon.
Hi, Amy. Thank you for this talk. So many youth pay a lot of attention to the entertainment industry, and I've also noticed that there's been a lot more representation of non-cisgender people in shows and movies and things like that. So do you think that helps at all, or how will that be evaluated, that impact on people's biases and bias-based bullying? And then another example is in the entertainment industry, that they've really embraced the artist Lizzo. But then on the other hand, I've read articles of physicians saying that undercuts their message of, the importance of maintaining a healthy weight. So it's like this push and pull here.
Yeah, it's absolutely a push and pull. I mean, I always think that generally speaking, positive representation of diverse young people in the media and the things they see is wonderful and fabulous. And some efforts at bullying prevention have started trying to kind of harness that and use celebrities and these public figures as intervention points to get out messages about being an upstander instead of a bystander. So when you see some of this, stop and say, this is not okay, and try to kind of do those campaigns that really harness and capitalize on public celebrities and the kind of support that they have. But you're right, there's a lot of messages and there's a lot to weigh there.